Hello everyone, I am Nivedita Jena from Ambika Prasad Research Foundation. Welcome to all of you to our channel Biodiversity and Conservation. So today our topic is the plants which are useful in the treatment of diabetes. So let's start. So first we are going to discuss about the diabetes. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. The most common is type 2 diabetes, usually in adults, which occurs when the body becomes resistant to insulin or does not make enough insulin. And in the past 3 decades, the prevalence of type 2 diabetes has risen dramatically in countries of all income levels. And type 1 diabetes, once known as juvenile diabetes or insulin dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin by itself. For people living with diabetes, access to affordable treatment, including insulin, is critical to their survival. So, there is a globally agreed target to halt the rise in diabetes and obesity by 2025 um, by using natural herbal products. Then we should know that why we should opt medicinal plants for the treatment of diabetes. Diabetes is mainly due to oxidative stress and an increase in reactive oxygen species that can have major effects. And many plants contain different natural antioxidants, in particular tannins, flavonoids, C and E vitamins that have the ability to maintain beta cells performance and decrease glucose levels in the blood. And according to many researches and published reviews, it can be said that medicinal plants are more affordable and have less side effects compared to synthetic drugs and are more effective in the treatment of diabetes mellitus. Some plants families which are the have the hypoglycemic activity, mainly belonging from different families like Leguminosae, Laminaceae, Liliaceae, Cucurbitaceae, Asteraceae, Moraceae, Araliaceae, etc. And here are the classification of anti-diabetic herbal drug on the basis of secondary metabolites are as follows. So first one is alkaloids. Alkaloids including mycomines, mahanimbine, erectin, barbine, and the phenols are the trigonelline, penitol, 2-hydroxy 4-methoxybenzoic acid, allicin, anacardic acids, and then the triterpenes are the alpha-myrin, 3-hydroxycalcolide, centellus, sapogenol, vancinols, and the flavonoids including myricetin, 6-hydroxypigenin, and the glycosides are the anthocyanin, leucopelargonidine, and leucodefinidine, etc. The first medicinal plant is Egle is presented here as example. It belongs to the family Rutaceae, and Egle commonly known as bale in Hindi, is indigenous to India and also known as bello in Odia, and in English it is called as stone apple. It is a medium-sized arm deciduous tree found wild, especially in dry forest, and is also cultivated throughout Indian subcontinent for its fruit. Literally, the fruits are globose with smooth, hard, and aromatic rind. The ripe fruit is used for digestive and stomachic complications, and the leaves, fruits, stem, and roots of Egle marmelis have been used in ethnomedicine for several medicinal properties, and It is also known as herbal medicine for the treatment of diabetes mellitus. Several reports indicates the blood glucose lowering activity in green leaves of Egle marmelas, and it is also one of the most important component of Madhumeha curry, which is the herbal formulation for curing the diabetes used for the treatment of lowering sugar level. Syzygium cumini, which is also known as jamun, which is a plant that can be used to treat metabolic syndrome related symptoms all over the world. The jamun tree is a valuable medicinal plant of the Myrtaceae family that has long been utilized in Indian and international traditional medicine. And this is an essential medicinal plant used in Pakistan, Indian, Sri Lankan, and Bangladeshi healthcare systems that have been used to cure a variety of ailments. And the diabetic individuals can gain benefits from its fruits and leaves. Uh, Especially the fruit aids in the conversion of carbohydrates to energy and regulates blood sugar levels. Because of its low glycemic index, diabetic patients should consume jamun during the summer, and it alleviates diabetic symptoms such as excessive urination or pussing. And the extracts of the leaves, seeds, and bark are very successful in treating diabetes. And intermediate hyperglycemia, which is pre-diabetes, is a metabolic disease in which blood glucose levels rise slightly beyond normal but do not rise to the threshold of diabetes. And it has been linked to a variety of micro and macrovascular problems. There are many Unani medications with anti-hyperlipidemic properties, and one of them is jamun. Then the next one is Holarina pubescens, which is also known as Indrajaba, belongs to the family Apocyanaceae. This is a deciduous shrub or small tree growing up to 3 meters high. Short stem has pale bark and several branches, and it is widely used in Indian and Chinese medicine in the treatment of diabetes. The seed extract increases insulin secretion and inhibits glucose absorption both in vivo and in vitro with a weak protein glycation inhibitory effect. Then coming to the Momotica charencea, which is also known as bitter gourd or bitter melon or Karela, is an annual climbing plant of the family Cucurbitaceae, and it is native to East India and is widely grown and eaten in tropical, subtropical, and temperate regions at present. And the vegetable is light green with a long cone shape, and it tastes bitter but is popular for its various benefits. There are many nutrients in this plant, and the alcoholic extract of this species is effective in lowering blood sugar levels, and the acetone extract of whole fruit powder lowers the blood glucose. Then the medicinal plant is Gymnema sylvestre, which is also known as Gudmari and belongs to the family Apocyanaceae. So the gymnema's ability to reduce sugar cravings is due mainly to a component called gymnemic acid, which has a similar structure to sugar molecules. Therefore, when it comes in contact with the tongue, it binds to the sugar receptors in the taste buds, preventing binding by the sugar molecules in food, which reduces the taste of sweetness. This effect can help the limit the desire for and consequent intake of sweet foods. So, and this medicinal species is located in many regions of Asia, Africa, and Australia, and it improves blood sugar levels, assists healthy weight maintenance, increases effectiveness of insulin. Inospora cordifolia belongs to the family Menispomaceae. uh, and known as also Guruji. Uh, this is a large, glabrous, deciduous climbing succulent shrub commonly found in hedges. And this plant, the plant stem has been considered as an indigenous source of medicine with anti-diabetic actions. And several studies reported that the daily administration of either ethanol or aqueous extracts of Tinospora cordifolia decreases the blood glucose level and increases glucose tolerance. And Dinospora cordifolia is widely used in Indian Ayurvedic medicine as a tonic, vitalizer, and as a remedy for metabolic disorders. So, in conclusion, despite the presence of anti-diabetic drugs in the pharmaceutical market, the treatment of diabetes with medicinal plants is often successful, and medicinal plant-based bioactive compounds can be a good choice for better diabetes management with fewer side effects. Thank you.